Hello, and thank you for taking the time to consider Bottles Up as you are about to take your precious baby home. Imagine yourself with your newborn infant leaving the NICU, where 24-hour guidance and care was provided from healthcare professionals, to a home environment where you are now the sole care provider. Are you feeling overwhelmed, anxious, stressed, or maybe even alone? Perhaps you have gotten used to seeing your baby on a feeding tube, and you are now worried if your baby will be able to successfully transition to oral feeding while sustaining nutrition. Well, according to the World Health Organization, there are about 15 million babies who are born preterm, with U.S. ranked as number 6 with the greatest number of preterm births. While preterm birth complications are known to be the leading cause of death among children under the age of 5, survival rates have increased and about 90% of premature infants survive. Once discharged, these babies are often still in need of medical care from professionals, although they are stable enough to be sent home from an inpatient facility, and advanced services are needed, such as those that are provided in a NICU, housed with a specialized team of trained physicians, nurses, and professionals. Upon discharge, families would be responsible with locating an outpatient facility that meets the needs of their child for ongoing care. So, now imagine yourself going home with your baby who has just been discharged from the NICU, and you already have an appointment scheduled with a specialized healthcare provider that will assist with successful feeding to achieve optimal growth. Does this relieve a little bit of the stress and worries? Bottles Up is a newly established, specialized medical step-down unit that focuses on swallowing as part of an outpatient clinic at DuPont Hospital for Children. We will provide solutions for newborns and infants who exhibit both behavioral and physical difficulties with feeding and swallowing. Bottles Up hopes that this would provide comfort for you as parents or guardians, as you will be aware that there are options available after being discharged from the NICU. DuPont Hospital for Children is considered one of the safest children's hospitals in the country. Bottles Up will make health services easily accessible and will be greatly beneficial for improving specialty services that are available through the hospital. Services will be provided by 3 skilled and highly trained speech-language pathologists, Deborah Ford, Marissa James, and Rio Eshelman. Our team of therapists are dedicated to implementing evidence-based approaches and will communicate effectively to provide individualized special care for each patient. We will be able to complete assessments and evaluate the swallow through the use of advanced technologies. Some of the services that we will be able to provide includes stimulation of oral motor movement, sensory development, stabilizing and monitoring breathing patterns, and improving the coordination for the suck, swallow, breathe patterns. In the case that your child is discharged from the NICU with a feeding tube due to the infant being unable to safely tolerate oral feeding, we can provide services for tube weaning trial. We understand that this is a stressful yet joyous occasion as you are finally able to take your child home. Our mission is to partner with families such as you to improve health and well-being of the newborn infant while providing ease to the family's lives when transitioning from the NICU to the home environment. Thank you.